Just like you take time to find the right friends, sometimes you might take a little bit of time to find the right therapist. Hi, I'm Meghna MUKHERJEE. I'm a psychoanalytical psychotherapist and the founder of the Engaging Circle. There is nothing called the right therapist, but the therapist that feels fit for you, the therapist that you feel you're able to open up to, you feel safe to. And just like you take time to find the right friends, sometimes you might take a little bit of time to find the right therapist, but talking about what you need in a therapist and expressing it to your therapist might actually help that equation to set right. 5 questions to ask a therapist. First of all, a lot of people who go for therapy don't know what therapy actually is. So you might want to begin from there. You might want to actually ask your therapist, what is the process of therapy? What really happens in therapy? And your therapist might be able to explain the entire process to you in very simplistic terms. And that might help you understand what exactly the process is going to be like. You might also want to ask your therapist if you feel it will help you, what their qualifications are, what their degrees are. Especially in the world of psychotherapy, there are different kinds of specializations. Your therapist can be a cognitive behavior therapist, your therapist could be a humanistic therapist, your therapist could be a psychoanalytic therapist. And you might want to ask them which particular line they are specialized in to see if the line that they're specialized in suits with the condition or the struggle that you're actually having. Sometimes it's very important after at least the first few sessions for you to ask your therapist what is it that you're actually going through. And that's extremely important, the process where you ask your therapist to explain to you what is it that you're going through. Some therapists are okay with diagnosing. Some therapists do not like to use diagnostic labels, but they like to explain what you're going through in different words. But that kind of clarity about what is it that what is happening to you, and for your therapist to be able to give words to that might actually be very helpful for you. Another important thing is that you are entitled to confidentiality. So you might want to actually ask your therapist what their confidentiality policies are, so that you feel safe in the space. And you might want to ask your therapist, conditions in which this clause can be, violated, or the conditions in which the therapist may need to break this clause of confidentiality. And understanding what confidentiality is and the fact that most of what you shared is confidential and when it can be broken might help you feel a lot safer. As to how long the therapy protocol is going to actually continue, and your therapist might be able to break it down for you. And it is something that you and your therapist can decide together, whether you want to go for a specific purpose and which is very session based, like you want timed sessions, or if you discover in the process of exploration that the problem is a lot deeper and therefore your therapy might now progress to months or even years. I guess that's something you would like to sort of ask your therapist and keep checking time and again as to where you are in your recovery process.